Welcome back to Flashpoint. This week, local healthcare provider StarMed stepped up big time to help parents amid this nationwide baby formula shortage. StarMed handed out its supply of formula for free at 2 different locations. The provider said it had around 1,100 babies that were given about a week's supply. That's a lot. And get this, the team even making a home delivery. They posted this on social media. They said a man brought his baby to get formula, but found out that all they had left was soy, which he had to leave because his son couldn't use it because of dietary reasons. However, a StarMed staff member followed up, told him another shipment was coming later that day. They exchanged numbers, and once it came in, the StarMed employee actually drove the formula to the man's house because the man was low on gas, couldn't get there. All done by a StarMed employee. Wow. Joining us now, Michael Estramonte, the CEO of StarMed. Thanks for coming on, Michael. We appreciate it.
Thanks for having me, Ben.
You know, there are a lot of clinics out there. There are a lot of healthcare organizations out there, but StarMed has managed to really strike a chord in this community over the last couple of years, thanks in large part to the pandemic. What do you all pride yourselves? What do you think that you all are doing differently?
Well, Ben, prior to the pandemic, actually, I first wanted to mention a big thank you to you for, it was back early part of the year, you brought Bojangles to one of our testing sites on the east side of town. That went over so well and it was so perfectly timed because the staff was dragging that day. Oh. And I just remember hearing so many positive things. So anyways, I just wanted to make mention of that first.
Please, only a small token of our appreciation. So I'm glad they appreciate it. But what makes you all different?
Well, so anyways, we started StarMed a few years before the pandemic. As a practicing chiropractor, I was always trying to make referrals, and a lot of our clinics were located in areas of town where there wasn't a lot of medical practices, a lot of uninsured, a lot of Medicaid. So I said, we're gonna go ahead and open up a clinic here and try to figure out how to serve the population and make ends meet. And we did it, and it was pretty difficult. We were learning what we didn't know. Bringing on we had a couple of medical directors that came through, some excellent physicians, helped us get the clinical side of things going, and we provided the management services. And I'll say, prior to COVID, it was just a matter of fulfilling our mission, just going into the underserved areas and making sure that where we can bring in some healthcare equity and just bring in 5-star care and a clean, modern facility. The building over on Tuckasegee on the west side, I don't know if you've ever been into it, but you go and it's beautiful. It's tiled, it's well lit, it's clean, technology is everywhere. So that was really our intention, our mission, way back before the pandemic started. And what we probably had that made us huge difference was we had the infrastructure. We had a really solid management team. Our COO, Tracy Hummel, and I could go down the line of just people that had true compassion and care in their hearts to do the right thing. And I think that was one of the main things that allowed us to pivot and look for ways when the pandemic hit to be relevant and helpful to the community.
It strikes me there also must be a culture that makes StarMed a little different, only because we highlighted before we came to you, one of the cases from this past week of where a father came with his baby. Evidently, the baby had a soy allergy, couldn't use the formula you had, and a worker actually drove to this dad's home, because at this point the dad was low on gas, drove to the dad's home, brought him formula. So there's a cultural thing too, evidently, that's happening there.
It permeates through the whole organization, and I can't take credit for. I'll tell you, there's some great individuals, everybody from the leadership team in the management office to the clinical support staff. That individual that did that, it wasn't looking for any credit, wasn't looking to say, hey, look what I just did to help this individual. This happens all the time at our organization, and it's humbling. When I find out about it, a lot of times I don't even get to find out about these little acts that are going on within our staff across, not just here in Mecklenburg County, but we're in a few other counties as well. It's within our core values. It is within our mission, and I do think all the meetings that occur, and we're always looking for ways to see where we can add value or where there's a challenge in the community, and say, how can we help solve this? I mean, the baby formula it was a great example of how a meeting last Thursday just ballooned into something that was it was just beautiful, and people were very appreciative. But yeah, we see a lot of that in our organization, and I do think it's the culture that brought it that way.
Because we talked about that, but also you all were out front. Really, how you made your name was, I referenced it earlier, was during the pandemic and getting testing out there to the masses, as well as vaccinations and shots and boosters and all that. Where does this thing stand now? I know we're seeing sort of a uptick in cases of COVID. What are you all seeing in your clinics?
So we've seen an increase in testing naturally over the last few weeks. I want to say it's gone up a factor of about 50%, so it's significant. Nothing like the Delta variant or when Omicron came through, but it's and I think a lot of people still have home tests, or those are a little bit more available. So our testing lines aren't they're not that long, and people get through them relatively quickly when you want to get a test here, whether it's an antigen test or a PCR test. But what we've actually seen more of is the monoclonal antibody treatments that we're doing. We went from doing like 5 a day a couple of weeks ago, and now we're doing 50 a day. So that's a little bit more of a tell that the cases are on the rise more than we realize, just because even though our testing numbers haven't gone up, people are seeking out treatment, whether it's the COVID pill or the monoclonal antibodies.
You all have proven, as you said earlier, you have the infrastructure so you can respond to a pandemic, or you can respond to infant sort of formula shortage. So the logical question here, what is next for StarMed?
So a few things. Obviously we recognize that the organization has a lot of has the ability to move. We're large enough but not too small to be able to move quickly, and we like to solve problems. And our heart is in the right place. I think when you can combine an entrepreneurial mindset with a caring heart, it's truly a recipe for good things. We're looking for people to serve people that might be going through a hard time in life, or don't have access. And so when I tell you the main objective right now is just to plug ourselves in wherever it makes sense. Our newest clinic that's going down on South Boulevard, down off Arrowwood Road and South Boulevard in the Star Mountain neighborhood, that clinic is going to be coupled and help. We formed our nonprofit. It's called the Blessing Foundation, which is actually named after my mother's maiden name. That sounds like a religious organization, but it's going to be supported by the Blessing Foundation, and it's going to be there for the population that may not have insurance or may not have access to quality health care, and so that's just one example. We're doing other things. We're partnering with organizations that are doing behavioral health and seeing where we can plug ourselves in. If like I said, I could go down a list, but we have a lot of things on the cooker. We have a great infrastructure. We onboarded about 5,000 people over the last 2.5 years. Obviously, not everybody's still with us, but during that time period, we recognize some amazing talent and individuals. Everybody from people that are in the leadership team at the organization to people that are in the clinical support staff. So we have an amazing roster to pull on, and we're looking for what's next and what makes sense. But and we like I said, we have a lot of things going on right now.
Yeah, you have a killer social media team as well, a well-known presence on Twitter that I think a lot of Charlotte enjoys. And listen, for folks, in case folks at home are wondering, this was not an advertisement. You all did not reach out. You are not paying for this in any way. We genuinely were interested in sort of what you all are doing, because we do think it's sort of different than what's happening in other places. And we were happy that we could bring your crew some breakfast back a couple of months ago at the height of the pandemic. And
that was awesome.
Glad they appreciate it. All right, listen, thanks for coming on. We appreciate it so much.
No, thank you, Ben. Have a great day.
All right, take care. More Flashpoint after this.